Making a change so people can see their loved ones in long-term care facilities.
Medical reporter Dina Baer has more on how agonizing grief is driving a new push for access.
When long-term care facilities locked down in March, no one imagined the doors would be closed to visitors for nearly a year. And while many facilities are doing their best to maintain safety and sense of connection for residents, families on the outside say the isolation is unbearable.
We started with a televisit.
Mom, hi, it's me, hi.
And a window visit at the same time.
I love you.
As time went on, the window visits just did not work for her as a dementia patient. It was just too confusing. She didn't know why I couldn't come in, and I didn't want to get her upset.
I miss you.
We first met Becky Liscombe in March when we captured one of her virtual visits with her mom, Joan. At the time, a resident at Terra Vista Memory Care in West Suburban Oak Brook Terrace.
It was better than nothing. I mean, I could still see her, I could see her eyes, she could see me.
But the new reality was so far away from the loving touch they were allowed just a few months before. During the summer, less of a physical barrier. There were socially distanced outdoor visits.
Can you wave hi?
She was confused and I couldn't come give her a hug. I have a lot of pictures of her reaching out, but it was still great to see her, and it made a difference.
Then the news Becky had feared throughout the pandemic.
She did contract COVID. I got the call October 18th. That's when my world changed.
I love you, love you, love you. We got this, okay?
While the 90-year-old remained asymptomatic, her health declined in the weeks that followed. That's when Becky advocated for compassionate care visits.
Going 7 or 8 months without even being able to hold my mom's hand, I know that's what everybody's been having to do. It's a sacrifice.
When she finally saw her mom,
she had just deteriorated. And when I got into the room, I said, Mom, I'm here. And I put my hand on her back. She was facing the wall in a fetal position and hadn't been responsive. When she heard my voice, she turned herself over and we hugged. It meant everything to her.
As family members advocate for more routine access to their loved ones, especially now as COVID vaccinations are being administered to staff and residents, the Illinois Department of Public Health told WGN, with community spread declining significantly since our fall peak, long-term care facilities in all regions of the state can now allow for indoor visitations, as long as they meet Centers for Medicare and Medicaid Services criteria. That means there have been no new COVID cases in the nursing home for 14 days. The nursing home is not experiencing staff shortages, has adequate supplies of personal protective equipment and essential cleaning and disinfection supplies, has adequate access to testing for COVID-19, and referral hospitals have bed capacity. Terra Vista Executive Director Natalie McFarland shared her facility's vision.
We foresee being able to do testing. We do screening of each of the families, the pre-screenings, vital checks, temperature checks.
You sure look pretty today, Mom.
I think it is coming to some sort of middle ground, creating that balance. We understand the risks involved, but we also understand the risks involved with residents not seeing their loved ones and just not having the in-person interactions.
What I want to do is continue to be a voice to get it into state law so that people can legally get into these facilities and visit their family members.
You're not taken care of all the time in a nursing facility like you are in a family environment. So you have to be an advocate for your own self.
Bruce Carmona has been in this Northwest Suburban nursing home for 2.5 years. The 63-year-old broke his neck after he fell into shallow water. Now he's paralyzed and missing regular visits with his brother.
I miss joking around with him. I miss playing catch with him. He used to bring me cookies. Don't get that much anymore.
But David Carmona also helped his brother do physical therapy several times a week. Access the nursing home no longer allows due to COVID.
He was at the point where he was almost lifting 100 pounds with his arms. He's probably back down where he'll struggle to get up 20 pounds now. So that's been really hard for him mentally.
I have a lot more anxiety than I used to have. I'm a lot more aggressive. Older people with dementia and Alzheimer's are asking questions. Why can't I see my family? They walk around like, to put it bluntly, like zombies. I mean, they're lost.
Develop a schedule. Tell us here, you get a half hour today and on this day. It makes a difference. Face-to-face is a lot different than doing FaceTime or Zoom or talking on the phone or texting or emailing. That physical presence makes a huge difference to them.
They're going to take good care of you.
Mom battled through asymptomatically for the 10, 14 days to be able to return to her memory care. And then the post-COVID struck. And that means, in her case, blood clots in the lungs. She had some strokes. She has pneumonia. When I walked down the halls on the way to my mom's room, I saw people that were formerly very vibrant, and they had declined. They had declined being alone in their rooms.
In the final weeks of Joan's life, Becky was able to continue her visits.
So many people don't get this. They don't get the ability to have a family member with them. And we've had some good time together since then. We've had some beautiful, beautiful moments. That's the only silver lining of this.
She was at her mom's side on November 25th when Joan died.
It was just everything. It gave her peace, and I was able to walk her home for her final journey on this earth, and she was not alone.
Both Becky and Bruce are part of Illinois Caregivers for Compromise. It's a group lobbying for more access to nursing home residents. In March, the organization plans to display hundreds of signs to commemorate the one-year anniversary of the lockdown and to honor all those who've died in isolation. Back to you.